Hi Vaibhav,
Hi, how are you?
I'm doing good. Thanks for coming, man. Please be seated.
Thank you for having me.
So, how are you doing?
Yeah, good. Well, amazing.
I got to know about your startup, and today we are gonna shoot this podcast, and I would like to know your entrepreneurial journey.
I'm excited to be part of this.
Hello, friends. Welcome back to EDI Podcast Season 3. This is your host, Vishal Modi. Friends, today's guest is not just building an ordinary startup, he is trying to transform the healthcare diagnostic industry. Friends, his purpose is big. He is developing something which is going to create impact in the society. Friends, his startup is supported by CrAdLE, the incubation center of EDII. Dosto, his startup is not just recognized by national and state government, but supported as well. He has got grants of almost 1.5 CR. Let's listen the story, the struggle story, the impactful story right from the founder himself, Vaibhav Satole. Vaibhav, how are you doing?
Yeah, going great. Yeah, amazing.
Vaibhav, I'm really excited to listen. Uh, I'm excited to know what exactly your product is. I have come to know that your startup has been backed by lot of incubation centers, has been recognized at national platforms.
Correct.
So, what exactly the company is about? What exactly IOTA does?
See, we started our journey in 2020 immediately after COVID pandemic,
Okay.
and our motto was to bring innovative and future technology in the space of pharmaceutical science, environment, and energy. So I
Okay.
came from pharmaceutical background from Naipur, Ahmedabad, and I,
Okay.
along with my mentor, Prasun Kumar, as well as Kaushik, we started this company in 2020. So
Okay.
initially we were talking about only innovation to bring the innovation from the academic setting to develop at a certain levels, and after
Okay.
that we can license to pharmaceutical company or healthcare company who can take it ahead.
Okay.
So after development we had a good prototype, then we got a good response from the market as well as we got
Okay.
patents everything. Then
Okay.
laterally we decided since we have come with that idea, so we should have to execute this as well as in the market.
Super.
Yeah, so then we founded next company under the IOTA umbrella. The name of the
Okay.
company is IOTA Diagnostic Private Limited. So
Okay.
that we started everything under that company to take this all regulatory process, all this commercial activity, including manufacturing,
Right.
production.
Right.
So the IOTA Diagnostic Private Limited we founded in 2020, and we started regulatory within a year. We got regulatory approval. So here in India, we have national regulatory body CDSCO who
Okay.
regulates this all pharmaceutical and medical devices, all the healthcare product. So we
Okay.
got approval in 2023. So our first innovation goes in the diagnostic space.
Okay.
We develop our hero product. We call it as a biosampler device. And
Biosampler device.
biosampler
Okay.
device, and this is something very revolutionary in the pathology industry. So I'll talk about the problem statement. Right now, in a present scenario, we collect 3 to 4 ml of the blood in a vacuum tubes through the venipuncture. We
Okay.
need to put up the syringe, and then after that, we are collecting blood in a wet condition.
Right.
It will goes in the vaccinated tubes, and it will maintain in anticoagulated environment for longer duration.
Okay.
Once we need to deliver this sample to the laboratory, then we need to separate out serum and plasma, and after that it will process for the further downstreaming analysis.
Okay.
So if we'll see in the diagnostic test, we can run 100 of the test using this 3 to 4 ml of the collected sample. But there are the few tests that require only few drop of the blood. Okay, so
Okay.
if we know
Okay.
the few techniques in a diagnostic as like PCR, ELISA, liquid chromatography, that
Okay.
require even less than one drop of the blood for the sample analysis.
Okay.
So mostly we saw around 90 to 95% of the blood sample collected goes in the wastage.
Okay.
And again, the second problem here in the Indian ecosystem, we'll see around 70% of the peoples, they are staying at remote locations. And
Yes.
for them, the diagnostic access is the problem.
Acha, is
So
it?
yeah, so they
Okay.
have to come to these urban localities or is this diagnostic pathology chain. They are bringing sample from remote location in a cold environment,
Okay.
and that will
Okay.
reflect in the cost of the test. So if we can see, there are
Right.
the few tests that are too costly. Let's say few thousands rupees, 400, 4,000 to 5,000 for the few tests only.
Okay.
So that is due to this additional cold logistic, everything that a process.
So just to maintain the properties and the quality of the blood,
Correct.
they have to get into cold box or something, and which
Correct.
increases the cost of the whole diagnostic process.
Correct.
Okay.
So there was so we have come with this device. So there was traditionally DBS paper, dried blood spotting paper. It has been utilized since last 2 to 3 decades back in the
Okay.
Western countries.
Okay.
The major application was in a neonatal screening and forensic research. So the idea was very simple: just put a few drop of the blood on a paper, DBS paper, and after that we can get it dried, and after that we can send to the laboratory for analysis. So that was the fundamental behind this alternative strategy to bring the sample from remote and rural areas.
Okay.
So there were few companies who started using the same approach in Western, but there was again limitation and the problem in the industry. So that's why pathology industry hasn't accepted this DBS approach in a pathology test.
Fine.
So we are the company IOTA.
So what does IOTA stand for?
So IOTA stand for, we wanted to bring IoT things, and we wanted to connect the digitalization in the future diagnostic space. Okay. So if I come back to our product, we developed this biosampler device. So that's based on the dried matrix technology as like DBS.
Right.
And again, whatever is the problems, limitation associated with that DBS, we have solved with our device.
Superb.
And again, it's very simple. We inspired a design with this glucometer. We just need to simply finger prick with the lancet.
Okay.
And capillary blood we can collect within this small portable device.
Okay.
And after immediately we can put back into the storage case, and we can deliver this device to the laboratory for any diagnostic test.
Okay.
So again,
Vaibhav, can you demonstrate or show your product?
Yeah, sure. I do
if
have
you
right
have.
now.
Yeah.
So initially we just need to lance with this lancet as like the similar to glucometer. And after the lancet we have this biosampler device. We are providing 2 units within the device. So after that, just the lancing, we need to just put contact into the skin, and whatever is that this ooze out blood we can collect within this device, and immediately we can,
and the blood stores into this.
Within this porous material. So that is our invention. So if you'll see, this is the only plastic component.
Superb.
So we have developed the invention that goes in the material science, that material able to collect and immediately get dried any biological fluid immediately. And once it reaches the laboratory, it will keep the intact sample integrity for longer duration, months to years, that depending on the analyte stability.
Okay.
And once it reaches, we can retrieve the all sample from this device, and it would be utilized for the analysis.
Okay. And so then again you place this inside the box.
Yeah. So we need to put back into this
and just
storage
this is
space.
okay. And this is needs to be taken to the lab.
Yeah.
Okay.
We can label it out with the name.
Can I see? This is such a compact box.
Yeah.
Keep the sample. Nice. So this is called biosampler.
Biosampler device. Yeah.
Excellent.
So this is if you see, this is a fundamental approach we have built for the pathology or diagnostic industry, wherein we can bring the logistic easiness for the sample collection, and it could have many application. We can open each and every segment in the pathology industry.
Okay.
So one of the interesting application we developed using the same technology for cervical cancer test.
Okay.
If you'll see the problem statement in the cervical cancer test, right now this is the second most common cancer in India, and there is already said that every 7 minutes one woman is dying due to the cervical cancer.
Okay.
Around 80,000 women are dying annually in India,
right.
And 1/3 of this death burden within only in India.
Okay.
So the bright side is that it is highly preventable and curable cancer.
Okay.
And this cancer is caused due to the human papillomavirus, that is a virus. It will have the prolonged persistent infection of this HPV. It will cause the cervical cancer after few years, up to 5 to 6 years. So we can prevent it with early screening. But the problem here within this diagnosis is that we have this very complicated setup for the diagnosis. Women needs to go clinics. The gynecologists are collecting sample from their private part, and again due to the social taboos, women are not. They are hesitating to do this test. We call it as a pap smear, cervical smear sample. So we leverage this our biosampler, this material, and we have developed very portable, again small strip, that would
Okay.
be again integrated on this menstrual napkin, and
Okay.
women can use during their periods.
Oh,
The
wow.
menstrual blood will be get collected onto this device,
Okay.
and we can send to the lab for analysis.
Okay. But do you require any expert to administer this, or?
No, anybody. So that is a self-empowered sampling.
Oh.
Okay. So there was a few academic research has been done by Tata Memorial Center. There is one of the study from Stanford University,
Okay.
and they found menstrual blood could be the alternative source for sexually transmitted infection, viruses.
Yes,
We can
yes.
identify, we can diagnose with that.
Okay.
And we had one academic study with Sterling Hospital,
Mm-hmm.
and we found very good outcome. So then we started working on it, and within a year we have developed this next invention
Wow.
using the biosampler.
Superb. So, where did you got this inspiration from, Vaibhav?
So actually I came from the rural background. I know the problems. So if any person, if he/she wanted to have any healthcare, so they need to travel the urban, at least tier 2, tier 3 cities.
right.
Okay. And if you'll see right now, the first part is the diagnosis. Okay. If you'll see in a diagnosis space right now, around 17% of these medical diseases that are depending on this blood report.
Yeah.
So and right now industry is talking about the teleconsultation. They have come with a very good platform. Clinicians are connected through the smartphone.
Yes.
But there is a missing part, the diagnosis.
Okay.
If we can connect that diagnosis initially, then after that teleconsultation can be facilitated through this whatever is the platform available.
Yes.
So that we can complete this entire ecosystem, and mostly cases we can handle through this novel digitalization system.
Okay. So, once you found the idea that you want to go ahead with, what kind of support did you receive from the ecosystem, from the government? Was it difficult getting the support?
I think our journey was started very at a good stage. After immediately COVID pandemic, government was also active towards the translation research. Government was also talking about the healthcare innovation. And while pursuing my master only, we secured around 65 lakhs of the fund from the BIRAC.
Okay.
And
So during your masters, you figured out that you want to go ahead with this business.
Correct.
Excellent.
So I took my master MS project as a startup.
Okay.
And I was serious about, I wanted to take it ahead in my master course.
Right.
And I was started working to develop the DPR, business model, everything during that time.
Okay. So, you thought of starting in Ahmedabad, Gujarat. You belong to Maharashtra. Did you get sometime thought of that it should be done to another city? I should go to, because it is health and tech. Maybe Bangalore would be a nice city. Pune you belong to is close to. So was that kind of doubt in your mind?
Yeah, actually, basically I came from Naiparik, and since I was very used to about this Ahmedabad, Gujarat ecosystem during my academic course, and again Gujarat have very good pharma hub. So mostly initially we were looking to use this biosampler for the pharmaceutical industry.
Okay.
And mostly CROs also catered here. Okay, so then we decided let's start from Ahmedabad.
Okay.
If required, we can have one more additional office or infrastructure in other ecosystem. But laterally also we realized that when you're talking about the manufacturing, Gujarat or let's say Ahmedabad will have the very good ecosystem. So if you wanted to manufacture the same thing in other ecosystem, let's say in Maharashtra, Karnataka, Bangalore, so we would have spent more money, as well as our cost for the manufacturing would be higher compared to Gujarat.
Okay.
So here we have very good access when compared to this vendors connection, again the manufacturing of this plastic and everything that we can easily access.
Okay. Then, so you figured this out. What kind of government support did you receive?
So mostly the finance. From the starting we got around till date we have secured around 1.5 crore from the central and as well as the state government for the entire research and development.
1.5 crore. These are the grants that you have received.
Only grants. We need not to pay back to the government. Again, from the regulatory point of view, again Gujarat government is again ahead. If I have been in other state, so the regulatory process is again one of the concern. But we have easily secured a regulatory approval process as well. So government is active towards here to encourage the startup.
Whether you are incubated at EDI's incubation center that is called CrAdLE. Okay. What kind of support did you receive from EDII?
See, basically, I came from a pharma background. I know this technology, but that management part, entrepreneurship part was lacking with me.
Right.
So that's why we decided to join a CrAdLE EDI.
Okay.
Because being the CrAdLE EDI was talking about this only the entrepreneurship development,
Yes,
business
yes.
development. So that's why we decided to start our journey from that campus.
Okay.
And that time CrAdLE was again very active towards the startup development. There were many companies was graduated from
Okay.
EDI.
Okay.
So that was our
So what
intention.
all support do you get when you are incubated?
So the financial support, few grants as again we have
Okay.
received from CrAdLE
So
EDI.
apart from finance, like let's say if there is a founder who wants to, doesn't have the know-how, so what can he expect from this kind of
Additionally,
incubation
we got
centers?
mentorship from the
Okay.
EDI. Again, that ecosystem who taught us how to do the businesses, what could be the sales strategy, marketing strategy.
Okay.
We got good support from the student as well as few of the
Okay.
student. They intern with IOTA. We
Okay.
have also learned from them.
Mm-hmm.
So that sort of the activities. Again, EDI is also have the good connection with the bureau, government officials,
Okay.
bureaucrats. So that we got highlighted.
That also helped.
Yeah.
Right. And you also have the co-working space they provide where
Yeah.
a kind of office setup
Correct.
could be there. Yeah. Which if a founder goes and looks on his own, then it would be very costly to him.
So initially we had only our office and we were started working with other incubation system for R&D, and then
Okay.
laterally we established our own R&D setup at EDI. Again, we
Okay.
have additionally our small scale up facility at EDI only. So they have
Okay.
supported that infrastructure support. as well.
Excellent. This was EDI story. Then tell me what happened ahead. Like you are incubated at different other centers
Correct.
also. IMA Ventures is one body which is supporting you. Tell me about that.
So, laterally we were looking further finance for commercialization activity, and EDI mostly facilitates government fund at early stage investment. Then we wanted to go beyond, so then we approached IM Venture, and they took long time to validate our idea.
Okay.
So it has been around 1 year. They convinced with our idea, and
Okay.
after 1 year they have come with the finance. So they
Right.
backed us IOTA since last 5 to 6 months back only they onboarded
Okay.
us.
Okay.
And right now they are supporting. They are bringing us their alumnus network, whatever the corporates connects. So that is again more needed us to enter into the market.
Okay. If you can tell me what is the process of getting incubated? Someone who is novice, who doesn't know, wants to start a startup, and looking for this kind of incubation, what could be the process?
I think it would be easy if you could directly contact the incubation managers.
Okay.
So they will guide you. So they might have the simple application process. You need to fill that information. They will contact you for the presentation, and after that you will have that interaction. They will understand your business model, what ideas you are developing.
Right.
And again, if incubation system, they are a sector agonist. If they comes under their sector, so they will take it ahead. And they will also see what kind of the support they can bring to your startup.
Okay.
So that sort of the activities will happen during this shortlisting process. Once it get onboarded, they will start mentorship, facilitating financial support from the government. If they have any good connects with the investor, they will also facilitate that connection.
And apart from incubation, if someone is looking for grants,
Yeah.
how difficult is to get grants in state like Gujarat, which is proactive towards startup?
See, I will see if you're looking for the government grant, you need to have the long patience.
Okay.
It will never happen within a few months you'll get the grant.
Okay.
So usually the government grant, if you start from today, so let's say around 5 to 6 months the duration.
Minimum, be prepared
Yeah.
for at least
Yeah.
5 to 6 months.
And they are at least 2 to 3 stages you need to present in front of the various people. They will
Okay.
shortlist. After that few months they will come back to you with few comments. Then
Okay.
after that you need to address that. So this is the usual process for any state government as well as central government grant.
Okay, excellent. Now, what is your further plan with this innovation? What is your future plan?
So right now, so we developed a good technology for the pathology industry, and right now we are looking promising application in the neonatal screening pharmaceutical industry, and we are diversifying this application. So before to that, we were as an individual company talking about this invention. But latterly, with this support partnership, there are the many groups are working along with us,
Okay.
and we are diversifying this product application in the different industries. So we are talking about this allergen test can be developed using this biosampler device. Again, we are seeing the biosampler can collect saliva sample as well as for the
Okay.
oral cancer diagnosis.
Okay.
So this sort of the application we wanted to develop, and mostly we see this biosampler could bring the home diagnostics.
Okay.
So people need not to go away, need not to
Okay.
go to the laboratory. So
Okay.
biosampler can facilitate this diagnosis, so they can self-sample their own blood or other biological fluid, and we can easily access this e-commerce, quick commerce platform that
wow.
can be delivered to the nearby laboratory, and they will have their report on their smartphone within a few minutes. So
this would really disrupt the
Yeah.
whole diagnostic industry.
Correct.
Yeah. So the kit coming at home,
Yeah.
you diagnose yourself, and the kit is again taken by maybe we have
logistic
this kind of
people, and
service.
it will goes to the nearby
Yes,
laboratory.
yes.
Then report will come to you. If you wanted to access the teleconsultation through the doctor, that platform you can talk with them. So what to do next? Otherwise, they will call to their facility for further diagnosis.
So
the
are
initial-
you working presently on this idea?
Yeah.
Okay. Excellent.
So we wanted to develop the SaaS platform, so
Uh-huh.
you can bring this all the things together, so that diagnosis will be done, teleconsultation can be fine, and again further if any wellness related advice that our doctors can also provide through this platform.
Okay. Where do you see IOTA after 5 years from now?
So we considered IOTA, and our vision is to be have as a innovator company across the globe. We wanted
Okay.
to bring innovation. So let's say tomorrow if you have any problem as like a COVID and whatever, so diagnosis related problem we should have that capacity to solve.
True.
So being as a from the vision point of view, we wanted to have that innovator component. And from the finance point of view, we see in the next 2 to 3 years we would like to have at least 150 crore company of revenues.
Okay. So are you presently making any revenue?
Yeah. Right now we just started our I would say we are at a pre-revenue stage.
Okay.
Last 3 to 4 months back, we started our commercial activity. We have listed this product on a Tata 1mg, Amazon. Again, we are working with a few partners, pathology chain. They are selling this our product, and we will see the healthcare innovation. It will take time for the diffusion, but within the last 2 to 3 months, we got very amazing response from the market. I would say if it get once clicked, then this product would be
Then there won't be any looking back.
Yeah.
So apart from grants, do you have any angel investor funding? Have you diluted any equity?
We have 2 institutional investors. One is IM Venture
Okay.
and DST STBI, that is from government of Gujarat.
Okay.
So they came as a pre-seed investor.
And do you have any pressure, like if there is an institutional investor?
At this moment, we don't have.
No.
Yeah.
Okay. And what do you think? What would be the right way or attitude to go ahead with your startup? Should a founder burn and grow very fast, or it should be slow and sustainable? What is your way of doing things?
So if I'll say in my industry, in the healthcare space, it would be to have very good, if you can have that small step, so you can learn that things at each and every stages. Tomorrow if VC will come, they will pump up this money, and after that you don't have that control on the finance part.
True.
So money will be then volatile. Okay. So I saw there are the companies who got VC's money, but they don't have control where his money is going, execution and everything. So being as a new startup, new founder, so it should have that small step only.
Okay.
That can have the more learning, and it could be the more sustainable model.
Yes. Super. In this journey of your, creating impact in the society, what would be your biggest challenging moment that you have faced, and what was your learning from that?
So if I'll see, mostly in the healthcare, mostly technology is coming from the Western. So nobody's talking technology birth from the India.
Right.
Okay. So that is one of the challenge, the adoption. So that's why mostly companies failed due to this adoption only.
Okay.
You will have the good support from the industries, good support from the institution. So there is back, people can trust on your ideas, what you have developed.
Yes.
So that should be there, and that we fortunately we have received that support, and that path is little bit easier for us right now.
Okay. So do you have any competition?
Right now we don't have any competition in the Indian market. There are the few competitor companies who are talking the same things, but they are available in the West End. When you're talking about this next product, this MST that built for the cervical cancer, the company is right now again at a clinical trial stage only.
Okay. Okay. What is the best compliment that you have got for your this product?
So compliment, if I'll see right now, I'm also reading the comment on the social media and everything. So people are telling this is something very amazing you have built it for the women health or whatever in the pathology industry.
Right.
So that again will excite you, motivate you,
Yes.
to run in the market. Exactly.
Vaibhav, what kind of advice you would like to give to the founders who want to get into this domain, this industry of healthcare?
I think in a healthcare industry that need very high level of the perseverance.
Okay.
Should have very good purpose. And again, because this is a field wherein the gestation period around 5 to 6 year minimum. So wherein company will get mature and again commercial activity will start.
Okay.
So if you have that level of the perseverance, again the patience, so I think you can win the market. And during that period, again you can learn the many things from the market.
Okay. So at least you need to have a patience, and because
patience.
the gestation
That
period
require
is
very
really
high level. If we'll see the other IT companies SaaS model that can able to develop the model within a few months or years, and you can start that commercial activity. But in healthcare, wherein this company is very highly regulated, you require regulation approval for each and every step, and it will never possible within a few years. So at least it will take minimum 2 to 3 years if you have that expedited process, partnership, collaboration. So then you can do that. So that perseverance, patience, if you have the good purpose as well as, so that can also win in the market.
Okay. And were you decided since your college days that you want to get into entrepreneurship? Do you have entrepreneurship background? What's your family background into?
No, I don't have any family background again, and I'm the first generation entrepreneur. I'm also learning from the market.
Okay.
So that's why I've been incubated at EDII. I'm learning from the IM campus as well as. And we are taking this small step.
So where did you got this courage from? Maybe this could be a good learning for the.
So as like you have mentioned these comments from the people that also excite you, motivations.
Okay.
The mentorship advice, they also motivate me.
But you did not think let's go for a traditional conventional way, job le lete hain, academically you are strong, so
no, I was looking to have slightly different things. We'll see. Means mostly my friend circle, they opted for the corporate job, and I wanted to do something new. So that's why I decided to enter into this entrepreneurship ecosystem. Then again, I wanted to do some slight new things. So that's why we came into this new product innovation. And again, we are looking to have novel business model. So that's we wanted to bring something unique blend in the market.
Okay. Did you do you feel that Ahmedabad or Gujarat has some role to play because you came here to do your masters and then you got this idea and the whole ecosystem you saw everywhere that startup is booming? So did Gujarat play a role in this?
I think Gujarat startup ecosystem is right now evolving.
Right.
So if we'll see the Bangalore, Pune, they have the mature ecosystem for the startup. Gujarat is just recently they started talking about the startup, because if we'll see earlierly mostly the businesses are traditional businesses, and they have come with might be new business model, but it was again depending on this traditional business. So when you're talking about this aerospace company, healthcare company, it just started few years back. Around during this COVID pandemic or before 1 to 2 years back.
Okay. What you would be doing if not IOTA?
No, I would have only this option.
Okay, super. Let's have a rapid fire round now. I'll ask few questions to you and you have to answer rapidly.
Yeah.
Okay. One word to describe your entrepreneurial journey.
It's amazing.
Superb. A book or resource that has significantly influenced you.
No, I never read any book. I mean, there
And,
are the
and-
many, but I just pick up the small things from the multiple books.
okay. So maybe a resource on an entrepreneur who has influenced you.
Will I say the Ritesh Agrawal?
Okay. Why?
So he started his journey from very zero, and he also motivate means what he's doing. So
Okay.
that motivated me a lot.
How do you unwind yourself after a hectic day?
So mostly I discuss things like to have hangouts with my friends. Okay, so that can solve everything.
Okay. Like you engage yourself, you seem very fit,
Yeah,
you do some sports. What do you do?
yeah, some sort of the sports activity, and just to go for the long journey with my friend circle. That can also.
Okay. How important is, for a startup founder to rewind himself, reflect what is going on in his life? How important it is to maintain work and life balance?
I think that required self-discipline, and it will grows automatically once you started into that phase. Because I'm also the first generation entrepreneur, and I also started having that self-discipline at a later stage.
So you evolve, you
Yeah,
learn things in
yeah.
the process.
I have this self brainstorming,
Okay.
and that can also tell whatever if any problems came or I can also internally solve within me.
Okay. Okay. Do you meditate?
Yeah.
Okay. Is it important? What benefits do you think?
Meditate, it would be the good. See, if you can meditate, so you can think internally, and whatever is the problem daily you are arising, you can solve. You can think on it in a peaceful mind, and you will
Okay.
have come with the many options. So this could be the answer. So whatever is the most dominating, you can pick up and you can start working on it.
Excellent. So you get more clarity.
Correct.
Right. Decision making process becomes easier.
Yeah.
Excellent. A mantra or a quote that keeps you motivated. Is there any quote that keeps you motivated?
I don't think so. There are multiple, but I cannot answer here.
What are your hobbies?
Mostly sports,
Okay. What sport do you play?
cricket, volleyball.
Okay. Excellent. You said that the biggest challenge you feel would be adaptability. Then how
Yeah.
you are going to answer that?
So, I mean, we had a very good collaboration support. Even, I mean, this our biosampler device was launched by Chief Minister of the Gujarat, and that
Okay.
is again one of the good achievement we have.
Okay.
Again, Zydus Group also they have endorsed this our biosampler device. So having this good backend support from the institutional, again from this industry, so people the startup can build more trust in the market, and so
Okay.
adoption would be a little bit easier.
Super. Vaibhav, I would like you to give a certain message to the audience who are listening this. They would be founders
Yeah.
or upcoming founders. What message would you like to give them? Is the entrepreneurial journey easy? What kind of challenges they're gonna face? How to stay persistent the way you are doing? Last message
Yeah,
to our audience.
I would like to say if you wanted to start your journey as an entrepreneur, so required very good purpose. Then
Okay.
again, perseverance is also required. And again, being as an
So
entrepreneur,
I heard that you are always repeating purpose, but then there are people who are very money minded.
correct.
And,
So that's why if you wanted to build, you being as a founder, you want the profit as well as. So there is a 3P component. The
Okay.
profit also you need to maintain. So
Right,
you need to
right.
keep that balance, purpose, perseverance, and a profit.
Okay,
Yeah.
superb. So people should not be only money minded or
Correct.
just
You should have to keep this balance for each and everything.
okay, and that is your mantra.
Yeah, that is like you could say it is my mantra.
So you said 3 P's: persistence, purpose,
Profit
and profit. Okay, okay, excellent. Yeah, sorry I interrupted you. So the last message for the
So,
students.
if you wanted to start entrepreneurship, so it would be very good if you can have a good purpose. And again, I would say for any new industry, it will take at least 3 to 4 years to mature this industry. So you should have that perseverance level. At least you should have to be sustained in the market 3 to 4 years. And again, being as a founder, company CEOs, you should have to maintain the profitability as well as.
Excellent, excellent. Vaibhav, thank you. Thanks a lot for giving your time. This whole conversation was very inspiring, and I'm sure people who are into health tech and health diagnostic industry, they need to sit with the notepad to absorb the content that you have shared, the way you shared about the grants and the help, the government support that you have received, and the whole journey, the process. Maybe if could be taken as an inspiration and lot of learning if they also want to come and reach the position you are. And really grateful that you took out your time from your busy schedule and came up for this episode.
Thank you, Vivek. Thank you for having me here. Yeah.
Until next time, stay curious, stay bold, keep building your entrepreneur journey. This is your Vishal Modi host signing off. Do share, subscribe, and comment on our videos.